I'm here at the Hartford Convention Center with Dr. Ralph Frieden, who is the triage doctor, and Dr. Giuseppe del Priore, a GYN oncologist, who was commenting on the sort of the quality of the, not the quality, but the severity of the illnesses he was seeing. Dr. del Priore, what sort of you were seeing more significant illnesses than you might have seen had these people had access to health care.
It's the first, exactly right. The first time I've been at this sort of event, and I think it's unnecessary suffering, unnecessary anxiety for the patients, unnecessary illnesses, because they're all pretty straightforward diagnoses and conditions that can be easily managed in a modern, developed world setting, where everybody has access to care, and you can get the simplest and most inexpensive, oldest medications. And because this patient couldn't get a refill on her Lasix, she was with uncontrolled hypertension. That's got to cost 5 cents a piece, right?
Less than that.
Right.
Dr. del Priore, tell us about the patient who you were saying was unable to get a medication refill because she was uninsured, and now you had to send her to the emergency room.
Yeah, so that was a woman Dr. Frieden and I were just discussing that for a medication that was pennies a day, she could have been, she could have avoided all of this, and she could barely walk, and I hope she has nothing more serious than uncontrolled hypertension. But if she has in fact had a heart attack, it's going to cost somebody in this area tens of thousands, if not hundreds of thousands of dollars. And it's a tragedy and a failure of our policy leaders, with every constituency, whether it's the physicians or the government leaders, that has to come to that.
And Dr. Frieden is the triage doctor, and you were telling me that you're seeing illnesses that you basically haven't seen since you were in medical school, and basically these people have lacked modern medicine. What did you mean by that?
Well, it's not that their illnesses are different. The diagnoses are the same, but the severity of the illnesses is dramatically different. The stories are different. I mean, there's one lady I spoke to today. I asked her how she was. She said, well, she's okay, but she has some trouble with her diabetes. I said, well, what do you take for your diabetes? She said, insulin. I said, when was the last time you saw a doctor? Oh, it was years ago. So how do you get your insulin? Oh, I take it from my brother-in-law. And what about her? And I get blood pressure medications from him too. So she basically is on all. She's navigating her treatment of her diabetes without anybody giving her any supervision. So it's mind-boggling. So that's the difference between having diabetes here and having diabetes in my practice at home.
I can tell you how perverse it is that from some perspective, like their insurance companies, they would consider her a criminal for taking someone else's medication,
That's right.
and not the executives who forced that policy that would create that situation, right? They would be considered modern heroes. We admire them for being able to take as much money out of the system as possible.
What a great comment, Dr. del Priore. And Dr. Frieden, one other thing. You're from the infamous state of Massachusetts.
Yeah.
Would you clear up for us why Martha Coakley didn't win the election? Was it about the Obama health care plan?
No, it had nothing to do with the Obama health care plan. Nothing to do with it. It had to do with a lot of misinformation that was spread around, anxieties that were spread around, and fear that was spread around that some type of national health insurance was going to be another communist takeover. I mean, it's the same thing that they did with Medicare. It's the same thing that they did with Clinton. I mean, it's just it's so easy to say something that creates fear in comparison to how difficult it is to explain something. But basically what I've seen here, what I've seen in the other two clinics, it all comes down to basically no insurance, no doctor, no medicine, and that's it. And it's the same with every person I've talked to, no matter what city they're in, no matter what diagnosis they have, it's all exactly the same.